Hi, my name is Patricio. I'm your vascular access specialist, and today we're going to talk about care and maintenance of central vascular access device, including PICC lines and midlines. One of the most important practices that you have to develop as a registered nurse is hand hygiene. Wash your hands with soap and water if they are soiled, or you can use alcohol cleansers. They're sufficient enough as long as your hands are not soiled. All your supplies that you will need should be at hand. The same supplies you will need for taking care of a PICC line as well as a chest central line. Dressing change kit, unsterile gloves, sterile 2x2 gauze, sterile 4x4 gauze. Some dressing kits contain sterile 4x4 gauze already. Saline flushes, alcohol swabs, injection cap, bio patch, and stat lock. There might be other supplies that you will need depending on your policy at your facility. To make the procedure easier, proper positioning of the site that you are going to work on is extremely important. In the case of a PICC line, positioning the arm at a 45 or 90 degree angle, exposing the PICC line site is important. You can achieve this by using temporary restraint. A tape is always good to use, or in cases of patients that are uncooperative, you can ask somebody to hold the arm. In the case where you do a central line, the site that you are work on should be well within reach. Put on a mask. Put on your unsterile gloves. Open your central line dressing tray. Remove the sterile towel, carefully holding on the edges, and position it under the arm or near the chest that you are going to work on. Proceed by placing the contents of your supplies on the sterile film. Open at least 5 to 6 of the alcohol, carefully opening it and not touching the alcohol. I'm going to show you how to remove the old cover to the PICC line with the use of your unsterile gloves. With one hand, left to right, hold on to the legging of the central line and start to remove the tape or the tegaderm from the bottom. Start from the bottom, remove the tape by pulling it up. The reason is when you're pulling it up, you're not causing accidental migration of the catheter. Pull it upwards, just like this, while your hand is still holding the leg of the PICC line or the central line. Remove the rest of the tape. If there's remaining tape like this, make sure you remove everything. You can also use gauze with saline to clean up. Usually it's easy. Here you go. Remove your unsterile gloves and put on your sterile gloves. Use your 2x2 to cover the leg of the line, of the PICC line or the central line, so you can maintain the sterility of your gloves. Now, the next thing you're going to do is to clean the catheter skin junction site. And this is where your 2x2 is useful. You put your alcohol, you can make about 3 of this. Your alcohol over the 2x2, you're going to use this to clean the skin catheter junction site. You're going to remove as much debris as you can. If the stat locks are dirty, it's got blood on it, it has dried blood on it, some debris, you can proceed by removing first the stat lock before you clean it. And this is how you remove the stat lock. Most stat lock has this clip-ons, and the way to remove it is easy. You pull this clip, lift, and lift this carefully. Make sure that that doesn't move. You can proceed by removing the stat lock. Boy, this is really so sticky. One suggestion I can make if it's sticky like this is you can use alcohol, and it makes it easier to remove a sticky stat lock. Now, once the stat lock is off, you are now free to lift, and you can see the skin catheter junction, and you can proceed by using the alcohol and create friction. Clean this junction site. You can invert this, remove whatever debris there is as much as you can, and let it dry. Once it is dry, you can now follow it with the ChloraPrep. The ChloraPrep is usually provided this way. You activate it by pressing these 2 parts here. Make sure the fluid comes out like that, and you can use this to clean. You can remove as much debris if there's still anything remaining. Again, you can invert this and clean it. If the anchor is a suture, obviously you cannot twist it, you cannot remove it. You can just proceed by cleaning right there on top, removing as much debris as you can. Okay? Now, let it dry up again. Always make sure you let the solution that you have used to clean completely dry up. This is how chlorhexidine kills the bacteria, from wet to dry. Never use a gauze and pat it dry. That is not correct. Do not pat dry the chlorhexidine that you use. Let it air dry. Now that the chlorhexidine has dried up, I'm going to show you how to put a new stat lock. Generally, stat locks has these 2 clips on the side. The 2 posts corresponds to those 2 holes. You lift it. Your sterile gauze is still there. You lift it and put this underneath just like that. Put the holes on top of those 2 posts. Close the clamp. Pull this wing part. Make sure that the adhesive backing, this is what I call the adhesive backing, sticks to the skin. The next part I'm going to show you is the bio patch. The bio patch has 2 sides, the blue and the white. The white part contains the impregnated chlorhexidine, the blue part should always face up. And you apply it on top of the skin, not on the catheter, on top of the skin. It's supposed to keep the skin clean. If your stat lock contains this bar tape, you can use this to further anchor the leg, just like that. If you don't have that, you can use an ordinary tape. If your site is bloody, you can use gauze with saline flashes and then use this to remove the blood. If this stat lock is bloody, you remove it, just like earlier. And then follow it with the alcohol and follow it with the chloroprep. If the site is still bleeding, you apply a pressure gauze, and this is how you do it. You get a 2x2, you fold it one time like that, this way and this way. Put it on top, directly on top of the bleeding skin catheter junction site. Use your tape, and this is how you apply your tape, with your finger on top. Stick one side of the tape on the first side of the arm. Pull the tape to the other side. That is how you create a good pressure on a bleeding site. You can double tape it this way. Okay? If the site is not bleeding, never ever put a gauze on top and then a tegaderm. This is not good. The only time you put gauze if that is bleeding or if there's drainage. And even if there's drainage, you should investigate what the drainage is about. Open the tegaderm halfway in this manner. Put this in the middle. Stick one side of it on the one side. Trace the edges. Remove the other side. Pull it down. Trace the edges of the tegaderm so it sticks well. Like this. Trace with your finger the edges so the whole tegaderm sticks well. Now you have a dressing. Put a label on your dressing. Date, time, initials. When you put your label, do not put it on top of the insertion site or this catheter skin junction. You can put it here, 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 whichever.